For most of 2008, political activist Marianne Carmel was hot on the campaign trail, working for her former Harvard Law School colleague and friend, Barack Obama. Exhausted but elated after the inauguration in January 2009, Marianne returned to Massachusetts for some well-needed rest.
Working on the Obama campaign, and we were crazy toward the end, and we were doing 30 functions in a month. And I just assumed, of course, I'm tired because I'm working so much, but I really think that part of it was that I was getting sicker and sicker, and I just didn't know it.
Marianne also saw her doctor at the Massachusetts General Hospital for what she described as minor abdominal discomfort.
Originally, I had pain, which turned out to be a lucky thing. I got sent in, I had a CAT scan, and it was diagnosed as a ruptured cyst.
Within a week, Marianne had an appointment in the operating room.
My surgeon, Dr. Del Carmen, who I adore, sat with me for a long time and explained all the possibilities, all the things that would happen in my surgery, that they would go in laparoscopically, take out the cyst, and biopsy it.
Pathology tests on the tumor confirmed her worst fear, ovarian cancer.
I was totally freaked out. I had told my husband originally, I said, I'm going in, it's either a cyst or if it comes back ovarian cancer, I'm toast. You know, I was like, I thought it was fatal. I had never considered any other possibility. It's like you don't get ovarian cancer because it's fatal.
Dr. Michael Bierer is the medical director of the Gynecological Oncology Program at Massachusetts General Hospital Cancer Center.
So historically, ovarian cancer has been called the silent killer because it presents without a lot of symptoms, advanced stage. It's been very difficult to treat. But progress over the last 2 to 3 decades has certainly improved median survival, progression-free survival for these patients. If you're an ovarian cancer patient, essentially, why come to the Massachusetts General Hospital Cancer Center? Well, the reason is that, first of all, outside expert care, brilliant surgeons, wonderful medical oncologists. So we have clinical trials that have therapeutic agents that they can't get in other hospitals, in other states, or even Massachusetts. And that's one of our strengths.
The Mass General Cancer Center also boasts a team that has both an aggressive and a kinder, gentler surgical approach.
I think that one of the novelties of our division is our surgical expertise and the fact that we are always trying to figure out ways to push the envelope surgically to treat this cancer. So we're a very aggressive surgical group.
Dr. John Shorgy is chief of the program and the surgeon leading the team with the latest surgical technologies available.
There are a couple of very exciting surgical innovations that have come on the scene fairly recently and that we've been incorporating. The minimally invasive or robotic program that we have here has really made a sea change in terms of how people are treated with uterine cancer or cervical cancer, and the recurrence rates and everything are the same as if you had a very big incision. However, patients like it a lot better. Patients go home sooner and return to work or return to their families sooner.
Dr. Marcela Del Carmen has been with the program at Mass General since 2003.
We know that we have one chance to get this right. So even if a patient has been told elsewhere that she's not a candidate for surgery, we will try to push the envelope here to make that happen. And we have, I think, not just in our division, but just the access that we have to other resources like liver surgeons, thoracic surgeons, where if we have disease that's resectable in the chest or the liver, we will try to make that happen to be able to look at the possibility of cure.
Marianne Carmel had successful surgery, followed by a new cutting-edge chemotherapy protocol.
Who's my baby? Who's my baby?
And while her cancer is gone, part of her tumor remains in a unique lab on the main campus.
The Gynecologic Cancer Program at the Massachusetts General Hospital Cancer Center established a tumor bank multiple years ago. And this is absolutely critical to our ability to do cutting-edge research. So most patients who come into Massachusetts General Hospital and undergo surgery with our team will consent and provide their tissues, both for research projects and, to a certain extent, these tissues are then used to fingerprint and type their tumors. And we hope in the near future that will guide our therapy for novel therapeutic agents, providing them tailored care.
This is perfect. So let's grow these for another 2 days. Yeah. And then we can do some experiments with them.
Well, obviously, my primary hope is that I'm in complete remission. It stays that way. The fact that they have stored my tumor and they can use it to test different protocols Obviously, that is a terrific thing that I guess you probably don't get at every hospital in town. What I really loved about Mass General was that all my doctors were there as a team. It felt like a place where people gathered around me to take care of me. And it built my confidence a lot. And I wasn't scared at any point. You know, this moment is all the more precious to me after what I've been through. I'm so glad to be here.
From the Massachusetts General Hospital Cancer Center in Boston, I'm Lynn Joliker.